Morning, everyone. I am Jeanette Mejias, and I'm the co-director of the New Jersey Family Engagement Hub. Welcome to our first webinar of 2025. We're excited to kick off with this important topic, Stronger Together, Enhancing Mental Health Through Family Engagement. In today's webinar, you will understand the importance of family involvement in supporting mental health and the benefits of family engagement and mental health. But before we get started and dive into the topic, I would love for you to please type in the chat your name, what county you're from, if you're a professional or parent or a provider, or you might be both. And I want you to think of the word that you will bring into 2025. For me, the word that I'm bringing in 2025 is grounding because I want more of that so it could be in alignment in all areas of my life. So I'm going to give you a couple of minutes to introduce yourselves in the chat. And again, welcome. Welcome, Jesse. We're glad you're here with us today. And really think about that word. What is that word you want to bring? What do you want to bring more of in 2025? Maybe for some of us, it's not a word. Maybe it's an activity. Maybe, you want to, walk 10,000 steps a day, or you want to focus on your health, or you want to focus on boundaries or more family time, whatever that looks like for you. Renisha Williams, welcome. I love that. Joy. We could use more joy in our life. That's a great word. Welcome, Maria. We're happy to have you. Welcome, Angela. Better communication. Yes, absolutely. Welcome, Patty. So keep those things coming. I love all these words because it's so important. And oftentimes we want to really be very reflective. We know that we closed off the year in December talking about some tips and strategies and surviving the holidays. But now we got to think about how we're welcoming 2025 and what we want more of. So these are all really great, great words. Thank you. Thank you for sharing that. Okay, without further ado, I'm going to turn it over to Kim for team introductions.
Good morning, everyone. My name is Kim Rivers, and I am the training coordinator for the New Jersey Family Engagement Hub. I am a wife and a mother of three almost adults, really. And my word for this year is centered. I want to really focus on always being centered in everything that I do. And now I'm going to pass it over to Tara.
Thanks, Kim. Hello, everyone. I'm Tara Semanek. I am the Southern Regional Family Engagement Specialist. And my word of the year, as I wrote in the chat, is realistic because I want to be more mindful of having realistic expectations and making sure those around me have realistic expectations of me also, so that I can meet those realistic expectations. I pass it to Faith.
Good morning, everyone. My name is Faith Victor. I'm the Northern Regional Family Engagement Specialist, and my word for 2025 is consistency, but also a tad of discipline. Consistency, being consistent in every area of your life, it produces fruit, it produces growth. So that's what I desire in my life, and I will pass it on to Alexis.
Good morning, everyone. My name is Alexis Pratt. I'm the Community Engagement Specialist, and my word for 2025 is creativity. This year, I look forward to bringing more creativity into my work inside and outside.
So thank you for joining us. I'm sure that many of you are familiar with our organization, but let's talk a little bit about who SPAN is. So SPAN is the parent center for the state of New Jersey. We provide information, technical assistance, resources, and support for families. SPAN's mission is to empower and inform, really not just families, but anyone, professionals who are interested in the healthy development and education of children and youth. So we have over 45 programs that cover everything from education, health, mental health, human services, childcare, child welfare, to name a few. We extend to over 40 national, regional, and local programs, and we are funded by government agencies, foundations, and fee-for-service contracts. So please, if you want to know more about what we do as an organization, I encourage you to go look on our website at www.spanadvocacy.org. So then let's talk about this project. This is the New Jersey Family Engagement Hub. And this project is all about recognizing that students thrive when families and communities are engaged in the school community. So it could increase the likelihood of student success. The goals of our project is to promote and to engage in activities and policies that build collaborative partnerships among youth, families, school educators, and community-based organizations in order to enhance child development and student achievement. So we are committed to having a centralized information hub for family engagement. We are committed to informing educators, practitioners, and families about the latest educational opportunities and barriers by providing technical assistance, resources, and support on what effective family engagement policies, practices, and activities, and how that can lead to improvements in student development, academic achievement, and long-term success. So how are we going to do that? Well, we're going to provide parents, caregivers with easy to understand and usable information. We're going to provide youth with tools with how to have a voice and share their experiences and ideas to help support their continued academic success. And we're about enhancing parent and family capacity to work with schools and professionals in order to meet their children's needs. So now I'm going to pass it over to Jeanette.
Thank you, Kim. So before we get into this portion of the webinar, we're going to launch a Mentimeter. And but what I want, which I failed to say during the beginning of the webinar, it would be helpful as our presenters are presenting the information to you today to just hit your react button, because we're not in an in-person forum and we want to ensure that this information is resonating with you. So if you can hit the react button throughout the webinar, that would inform our presenters that this information, you get it. This is sitting with you. This is important. It's valuable. So thank you for that. I already see some reactions, so I appreciate that. Okay, so as we start the new year in 2025, many of our families maybe experience what we call those post-holiday blues. This is a time of year where the winter weather is at its coldest and the daylight hours, it's at its lowest. And for many, it can trigger a common seasonal depression. So we're going to launch this poll. And the question is, how do you combat the winter blues? So we're going to put the link in the chat. We're going to ask you to participate and just write, what do you do to combat those winter blues? So we're going to give you couple of seconds to think about that. Maybe, when I think about winter blues, um, I think for me, I look forward to planning a vacation. So that certainly gets me out of that, you know, that that feeling of, oh God, it's dark already at 4 o'clock. Um, so think about that. What do you do to combat those winter blues? I do see in the chat, someone says they go for a walk. That's excellent. What a great way to really shift um, your brain thoughts, right? Our brain is so powerful. So that's excellent. Okay. Yes, Craft, a good book. Absolutely. So let's see, based on the participation, what are some of the suggestions? We also see Jennifer in the chat says they plan a movie or game night, play music. Excellent. Excellent. Those are all great ideas and great ways to cope with winter blues, honestly. Are we able to put the results in or? I know some of us were using the chat, which is perfectly okay. All right, these are some great responses. Exercise, yes. Hibernate, reboot, charge. Walking my dog, yep. Go outside, bundle up, go outside, go to the parks. Yeah, that is all wonderful. Getting yourself out, getting some fresh air could really change your thoughts almost instantly. So you guys are ready. Oh, I like that one. I fill my home with plants and lights. I love that. Yes. Whatever it takes, there's no wrong answer. It's whatever brings you joy, whatever helps you combat those winter blues. I think these are some really great, great suggestions and great practices too. Wonderful. So you guys already kind of have a sense of some tools, right? That you have your go-to tools to combat those winter blues. Excellent. So that's a perfect segue as we start to talk about what is mental health. Mental health is such, we were having a little bit of a discussion, the team prior to coming um, on the webinar, the importance of mental health and what that looks like for us. Um, things have changed so much through the years in mental health, especially after the pandemic. I mean, we're 5 years after the fact, and mental health continues to be um, a very prevalent discussion and prevalent topic. And so it's important for us as parents, as educators, as community providers to really take a temperature of our students because we know that the whole goal is for our children to have academic success. But if their mental health is challenged or they're going through some challenges, that's going to be very difficult. So promoting mental health and well-being is critical to fostering a healthy and learning environment and ensuring that students can thrive academically and personally. But again, If we're not taking the temperature and we're not noticing, that could be very challenging to have our students rise to those academic performances. A student's mental health plays a significant role. Overall development, we know that it impacts their academic performance and also their social interactions. So we have to be very mindful. Oftentimes when a student perhaps is not doing as well, there's different narratives that the student is not motivated, or the student, is not willing. But really, the question is, what is preventing the student? Why has the student went from this level of academics and changed so drastically? So we really have to be thinking in through those lenses. Alexis, I'm going to have you move over to the next slide for visual purposes for the audience. Wonderful. If we could just move to the next one. Thank you so much. So, mental health at a glance. Mental health presents in many different ways. Typically, when someone starts displaying signs of anxiety, depression, behavior issues, perhaps drugs, alcohol usage, there can be a variety of triggers: lack of self-regulation, inability to manage emotions, fatigue. As you know, if we do not get enough rest, it can also impact our mental health. Fears, whether we are concerned about stressors, money, food, housing, family issues. Maybe there's an underlying diagnosis such as autism, ADHD, ODD, social media. Research has shown that there is a correlation between social media use and anxiety and depression. In fact, there's a study show that Australia recently banned social media use for kids under the age of 16. And I have to tell you, Australia has it right. Oftentimes, we as parents have to be very cognizant and monitor our children's engagement in the social media spaces. We know nowadays children have cell phones as early as 8 years old. And there has to be a balance. We know that having a child constantly in those spaces, it opens up a different world. It can literally have a child exposed to cyberbullying and actually some dangerous activities. So you really want to be mindful of that as well. But mental health impacts learning, and we know this. It impacts relationships, and ultimately it impacts long-term success. And 3/4 of mental health issues, they manifest way before age 25. They're starting very early on, and half by the age of 14. And it's really, it just gives us, it puts us as parents, as providers and educators, it puts us on notice. So I want you to think about that as you hear, as we keep unlayering this topic, and see where it fits for you, where it fits in your child. And really, the goal is for you to add these strategies to your current toolbox. And now, over to Kim.
Thank you, Jeanette. So now we're going to talk about the 4 pillars of mental health. And this is actually a result of a lot of research and collaboration from the Strengthening Youth Mental Health Initiative that was led by Governor Murphy as the chair of the National Governors Association, where they focused on addressing the national youth mental health crises through a bipartisan collaboration. So they met. They included youth, governors, experts discussing over 4 convenings and having calls. And this culminated in a Strengthening Youth Mental Health Playbook. So this resource offers solutions to help address youth mental health systems, discussing accessibility and affordability and awareness barriers in order to empower caregivers, educators, and community members. So centered on this research are these 4 pillars. So the initiative provides a kind of holistic framework to support youth mental health needs and build systems for future generations. So these 4 pillars address the core challenges to that system to support youth and mental health. And it'll help states to address the needs of youth that are in crisis. And certainly, this is all about collaborative care, because mental health is a shared responsibility. So we really want to focus on bridging the gaps between families, educators, professionals, and communities, so we can move from isolated efforts to more of an integrated care. So what are the 4 pillars? Well, number 1, addressing prevention and building resilience, where you support youth with the tools that they need to respond to stressors and challenges in order to reduce the risk of mental health conditions and be proactive in identifying and managing existing conditions in order to prevent crises. Number 2, increasing awareness and reducing stigma. So when we promote awareness about mental health knowledge and resources, we can help decrease that social and structural stigma around youth mental health challenges. Number 3, ensuring access and affordability of quality treatment and care. So when we can remove the barriers to care, including that unaffordable costs, lack of insurance coverage, or even the depleted workforce that support mental health, in order to ensure that high quality, trauma-informed, and culturally relevant care is accessible to youth in their spaces and places and within the time frames that they need in order to get that mental health addressed. 4, training and supporting caregivers and educators. So if we can expand training and supports so that those who are caring for and interacting with youth on a daily basis have an understanding of the tools to identify mental health needs and access to the relevant supports. So let's talk about protective factors. What are protective factors? Well, throughout our lives, multiple individual, social, structural determinants actually combine to protect or even undermine our mental health. So psychological, biological factors such as emotional skills or substance use or genetics can actually make people more vulnerable to mental health problems. Social, economic, geopolitical, environmental circumstances, poverty, violence, inequality, environmental deprivation can increase the risks. So protective factors, it's a set of characteristics that can present at both a family and community level. And when these factors are present, when they're exercised, they can actually help reduce the risk of, I don't know if you've heard of the term ACEs, the adverse childhood experiences. It's a term they use to reflect the experiences of our youth, our young children, when they're exposed to abuse or neglect. That can have a long-term impact, because the research shows that exposure to ACEs at very young ages can not only have an impact on our mental health, but it also has an impact on our biological health. In other words, it impacts the DNA. It makes people more vulnerable to cancer and other illnesses because the stressors on our body can go into our DNA and help us be vulnerable to disease. So, protective factors, number one, parental resilience. So, this is about the parents or family members being strong, the ability of parents to deal effectively with stress, with adversity, with trauma can really impact how their children receive those mental health potential experiences. Social connections. That means having relationships. If we have consistent relationships with families, with friends, with neighbors, with other community members, this can help us process stress and reduce that adversity. 3, concrete supports in times of need. And what this refers to is the brick and mortar. That means access to supports from agencies, from organizations such as our organizations, from access to resources, mental health resources, even activities like sports, putting in concrete supports, utilizing what is available throughout the state, what's available throughout your county or within your districts can really help our kids have less mental health challenges. 4, knowledge of parenting and child development. We have knowledge that we develop as we are parents. There's knowledge that we learn from our experience. Implementing that effectively can really help address ACEs. And number 5, social and emotional competence for children. That's social and emotional learning. Our children have to be able to properly understand themselves and their emotions and develop an ability to process how they deal when life challenges come up. So now I'm going to pass it on to Faith to talk about strategies for families.
Thank you, Kim. Strategies for students. Prioritizing mental health equips students with the resilience needed for academic and personal success. Healthy habits, good food and exercise. Fuel your body and mind with nutritious foods and regular physical activity. Eating balanced meals and staying active help improve focus, energy levels, and overall well-being. Practice self-awareness, understanding emotions and triggers. Learn to recognize your emotions and the situations that cause them. Understanding your feelings help you manage reactions and build emotional resilience. Stress management techniques, breathing exercises, and mindfulness, and even journaling. Combat stress by practicing deep breathing, mindfulness, or journaling your thoughts. These techniques can calm your mind, improve clarity, and reduce anxiety. Encourage peer support and teamwork. Work together with friends or classmates to tackle challenges and achieve goals. Supporting and learning from each other strengthens bonds and builds a sense of community. Take breaks from social media. Unplug from the digital world. To refresh your mind, regular breaks from social media reduce stress and help you stay grounded in the present. Find fun things to do. Incorporate enjoyable activities into your routine. Hobbies, creative projects, or spending time outdoors can boost your mood and recharge your energy. And be kind. Spread kindness by showing compassion to others and yourself. Small acts of kindness create a positive ripple effect and foster a supportive environment. Strategies for our families. Prioritizing mental health helps families stay bonded together and to grow together. Promote work-life balance and self-care. Encourage family members to prioritize physical activity, relaxation, and good sleep hygiene. Create spaces for unwinding and emphasize the importance of balance to maintain mental and physical health. Learn to recognize signs of mental health challenges. Stay informed about warning signs of stress, anxiety, or depression in family members. Early recognition is key to providing support and preventing escalation. Build strong family bonds and encourage open communication. Foster an environment where everyone feels safe discussing mental health. Encourage open conversations, share experiences, and reassure family members that seeking help is a sign of strength and not weakness. Create routines to foster stability and reduce stress. Develop daily schedules that promote consistency and reduce uncertainty. Routines help create a sense of normalcy and make managing responsibilities more manageable. Promote healthy academic and social habits. Encourage realistic workloads and participation in academic support programs if needed. Advocate for social activities that bring joy and foster connections, creating a balanced and fulfilling lifestyle. Consider adopting a pet or a plant. Adding a pet or a plant to your family can create a sense of responsibility and joy. Caring for a living thing often brings comfort and promotes emotional well-being. Recognize when to seek professional help. Be aware of challenges that exceed what can be managed within the family. Seek professional help to address more complex mental health issues effectively. And have a plan, action steps, and a 988 hotline. Prepare for mental health emergencies by developing a clear action plan. Familiarize your family with resources like the 988 hotline, ensuring everyone knows how to access help when needed. Strategies for educators. Promoting educators' mental health well-being enhances their ability to create supportive and effective learning environments. Develop mental health education and awareness programs. Provide programs that increase awareness about mental health, train students as mental health advocates, and share resources. Equip students with the tools and knowledge to support their well-being. Create a supportive and inclusive environment. Foster a culture of belonging by promoting diversity educators by celebrating diversity. Educators, staff, and students can collaborate to ensure everyone feels valued and supported. Use positive behavioral supports, PBS, and inclusive teaching methods. Implement trauma-informed teaching practices and PBS strategies that emphasize empathy, understanding, and positive reinforcement. These approaches create safe spaces for all learners. Invest in mental health focused professional development. Equip educators with the skills to recognize and respond to mental health challenges. Training ensures staff can support students effectively and promote a mentally healthy school environment. Enhance access to mental health services. Offer accessible mental health resources such as in-school counseling and mobile apps. Early intervention programs can help address issues before they even escalate. Regularly assess and improve well-being initiatives. Gather student feedback through surveys and engagement tracking to evaluate existing mental health programs. Use the insights to refine and enhance initiatives for maximum impact. Promoting mental health among students, families, and educators is essential for fostering resilience, strengthening relationships, and creating supporting environments that drive academic and personal success. Now, Dr. Lanisha will provide us with information for community-based organizations.
So community-based organizations, you are the boots on the ground. You have the eyes and ears of your community. So use those to identify the needs of the community and the families that you serve. Provide workforce development for mental health professionals. Host mental health awareness events. Talk to your mental health professionals to see what services or resources or information that they need and be there to provide that for them. Provide accessible mental health services and resources. As the eyes and ears, you know how people are getting their information. So use that information to provide these accessible resources. Encourage collaboration between schools, families, and yourself. So you're the bridge. Be that bridge and encourage collaboration. Work with your schools and your community and provide them with information that you're hearing and ask them to provide you with information you're hearing. Advocate, advocate, advocate. as the boots on the ground and knowing what you can advocate for with your local government, your county government, and your state government about funding and policies that are needed for your community regarding mental health. Host mental health workshops and seminars and stress management programs. You can host these things not just for yourselves and your staff, but also for your educators and for your families and your youth within your communities. Use those accessible means to get the word out about the workshops and seminars that you're hosting. Stress is a big factor in all of our lives. It affects not just our mental health, but our physical health. So please provide these stress management workshops. Develop peer mentoring programs that connect students with mentors. Mentors are key. I know I had a mentor when I was a kid, and I still have mentors today as an adult. They help us. They help us get through the tough times. They help us celebrate our successes. So establish mental health programs that include mentorship, not just peer mentors, because those are great too, but also adult mentors, generational mentors. Those are keys to getting our kids, our families, and even our staff through some tough times. Those mentors provide advice, guidance, and emotional support. As I said, I have a mentor that I still talk to this day, and he helps me through everything. So I think that those are the keys to some of our successes, and especially for our children. Mental health resources within our state. So the state of New Jersey has implemented a program called New Jersey 4S. And that program is a relatively new program. It was started in late 2023, and it's a hub very similar to the New Jersey Family Engagement Hub. This hub is innovative, and it talks about services and resources within your communities that are regarding mental health. Its focus is mental health. NJ4S is available in every county in the state of New Jersey. Actually, the program is set up by vicinages, and so those vicinages typically are counties. So please go to the New Jersey Department of Children and Families website, and you can find the New Jersey 4S program in your community. Another resource is NAMI, NAMI for New Jersey. NAMI is the National Alliance for Mental Health. It provides information and services and support for mental health. There is a NAMI chapter in New Jersey, and typically there's one in every county, but you can look on NAMINJ.org to find the NAMI chapter near you. Faith mentioned it earlier, 988. 988 is our crisis hotline. All you have to do is pick up your cell phone and dial 988, and then you'll be connected with emergency support services. And lastly, but certainly not least, New Jersey, we're fortunate to have a number of state-funded programs for mental health support. Please explore those programs. Typically, they're funded either through the New Jersey Department of Children and Families or the New Jersey Department of Health. So please look at those websites and explore. You can even put, New Jersey mental health support in your Google search bar, and they'll come up. So please utilize those services to get the mental health support that you need. Crisis intervention and mental health first aid. Believe it or not, there is a first aid training for mental health. I've taken it. It is phenomenal. It teaches you the signs to look for. It teaches you the steps to take if you encounter someone that is having a mental health crisis. So one of the signs to look for, or several of the signs to look for, is withdrawal. If you're used to a person who is so outgoing and always, on the go, and all of a sudden that person withdraws into themselves, stays home, it's hard to contact the person, that's withdrawal. And that's something that you should look for. Mood changes. Again, if it's sudden, if the person is who they are, sometimes I'm very quiet. I'm very quiet. I'm an introvert. But if all of a sudden I am, the life of the party, check on me, right? Because that's not me. If you're talking to someone and all they talk about is how hopeless life is, how hopeless their circumstances are, that is a sign to look for. Some of the steps that you can take: stay calm. Don't get overly agitated with the person. And also listen. Mental health first aid, one of the biggest things that they teach you is to be an active listener. So please listen. Best practices. Assess the risk. What are the chances that this person is going to do themselves harm? Connect the person to care. We've given you some resources. Connect the person to those resources. And absolutely, absolutely urge the individual to follow up with a professional. One of the things that I've done is I've asked someone, what is your health insurance if they have it? And I'll go on the website for the health insurance and help them look for a professional. So those are some of the steps that you can take. And those are some of the things that mental health first aid teaches you. And again, you can call mobile response, and we've provided the number for you. And then last but certainly not least, again, we're telling you, call 988. And now I will turn it over to Jeanette to talk about some of our upcoming events.
Thank you so much, Lanisha. That was fantastic and such an important topic. I have to tell you, I always walk away with something new, a new strategy, a new tip. So we do have another webinar coming up next month. We're excited because we're going to jumpstart and talk about summer camps. I know in your mind, you're like, we're in winter. Why in the world are we going to talk about summer camps? It's never too early, so we're going to explore that and be sure to register for it. It will take place February 11th. We always have our webinars the second Tuesday of each month, so we hope to see you back. And this concludes the portion of our webinar today. Thank you so much for being here with us. We know that you could have chose to be anywhere else, but you chose to be here today. This topic is so critically important, and so we hope that you had a lot of golden nuggets and takeaways. We invite you to scan the QR code that you see on the screen and fill out the survey. Your feedback, we read it. It's very important to us, and we want to ensure that these webinars continue to be of value to you. Also, if you require to receive a certificate of participation for the webinar, just choose either yes or no when you're filling out the survey. Again, thank you for joining us, and we wish you a wonderful week, and we'll see you the next time.